Okay, thank you. Thank you so much. So, hi everyone. We are very excited for this session. Thank you so much for joining us on this very special day. Happy World Hearing Day to all of you. I like to take a moment to express my gratitude for all of you, your work to advance hearing science and advocate for hearing health. We are very excited to introduce ARO Education's new initiative, cutting-edge techniques and models with application in hearing research. These sessions are going to be dynamic online panel discussion and designed to highlight how technology advancement are shaping auditory and related research. Our expert panelists will share different methodology and models, and they offer a brief background insight and engage in interactive discussion with you. For our first session in this exciting series, we choose the topic application of auditory periphery computational model. And those who know me, I'm a bit biased on choosing this topic because it was my PhD thesis, related to my PhD thesis. But computational models are powerful too for understanding auditory processing and improving experimental design. And also, its application in hearing devices are growing rapidly. In this session, we are honored to have two of the leading experts in our field, especially on this topic. Um, our first panelist is Dr. Carney. Uh, Dr. Carney is a professor of medical engineer at University of Rochester with joint appointment in neuroscience with a background in electrical engineering from MIT and University of Wisconsin-Madison. Her research bridged neurophysiology, psychophysics, and computational modeling to understand auditory perception. Her work on neural mechanism in complex sound processing, particularly in noisy environment and amplitude fluctuation detection, along with her computational models of auditory periphery, provides critical insight into hearing function and inform the development of improved hearing aids and auditory prostheses. Um, Dr. Sarah Verhulst is our next panelist. Dr. Verhulst is a professor in hearing technology at Ghent University, where she leads the Hearing Technology Lab, an interdisciplinary group working at the intersection of auditory neuroscience, computational modeling, and hearing technology, with expertise in electrical and acoustic engineering and computational auditory neuroscience. Her research combines EEG, autoacoustic emission, and computational models to study peripheral hearing loss, including cochlear synaptopathy and other hair cell dysfunction. Her work is pioneering in developing novel EEG-based hearing diagnosis, personalized treatment strategy, and AI-driven hearing technology. So let's get us started and explore how these computational models can help us in our research in the hearing field. And thank you again for being here. So I want to invite the panelists to provide us with a brief introduction to the computational model of auditory periphery and explain what these models are and why they are valuable in hearing research. Um, Maybe Dr. Carney or Dr. Barhas can start.
I can start. To prepare for this, just made kind of a list of, I think, I think of them as sort of tips, or strategies for using models. But if people have more detailed questions about the models themselves, we could, it might be a hard forum to talk about that, but we could try. Um, but I was sort of thinking back over our history. So our basic model for auditory nerve response is now getting elderly. It's 32, 32 years old. It's getting old, older than most of you. Um, it started though with a question. I think it's important to always just start with a real goal. And the goal was that we realized while doing recordings from auditory nerve fibers and others had realized too, that the responses are quite nonlinear. And so to figure out how the nonlinearities would work together and change the population response, that, that sort of the input to the brain, we really needed a model that would capture the nonlinearities, such that, neurons responding either at CF or off CF, therefore responding at effectively different sound levels, we could get a picture of the whole response. And that was our goal, because we wanted to understand the population response. When you're recording from auditory nerve fibers, you get what you get. You get, a scattered few fibers with different CFs. So the model really helps you put together a more complete picture of what's going on. But in any case, you need a goal, and then you need to include what's important to you. In our case, it was level dependent tuning. That included level dependent timing in particular. And you want to keep the rest simple, right? So we didn't get into biophysics anywhere we didn't need to. We didn't know enough at the time about a lot of the cochlear mechanics to try to include a full cochlear model. So we went with the filter bank model that we stuck with for many years. And I think Sarah will give a nice compliment to that, because her approach has been very different. Anyway, that's sort of the first tip. My second very strong advice is to just make it as public as possible. Share it. Whatever you do, share it as quick as you can. I think that's becoming more common nowadays, and is now becoming insisted upon by some funding agencies. But there's always been a kind of a split in the field of people who work on models and then keep them to themselves. I think almost as if they feel like they'll be scooped if they share them or something. But if you want to make an impact and help the field, give it away. Just share it. And along with that, you need to try to make it as accessible as possible so that somebody else can read it. I actually see that one of the people logged in here is our lab programmer. We've tried to keep our model away from our programmer um, to some extent. He's done an awful lot with it to make it more accessible, and I'll talk about that in a moment. But we want the basic code to be as readable and, in a sense, as dumb as possible. To really let somebody else grab the code, step through it, and understand all the blocks. So if we have tried to avoid fancy programming. On the other hand, in our latest years, or most recent years, we've been trying to make it much more accessible to a wider audience by making apps and putting it on the cloud. When you do that, you sort of fix it, because it's harder for people to go in and make changes inside the model. So in the past, we've always just given the MATLAB code away, and that's still available. But that at the same time, we've got a lot of help from real programmers to make these apps. And Doug Schwartz, who's on here, has done a lot of that work, so that hearing and science students can use it, or linguistic students could log in and look at responses to speech sounds and things like that. So that's one aspect of the accessibility. That, I would say, is a lot harder, and you really need professionals to help with that. Other than that, my other advice, and then I should hand it over to Sarah, is don't fall in love with your models, because they're always wrong. And you need to be ready to walk away from it, either to change it and try to improve it when you notice there are problems, or walk away from it and try something different. So that's my other good advice. So now I'm
Thank
interested
you
to hear
so
what Sarah has to say.
Yes, thank you. This is really wonderful tips and advice, and I think I can just complement these a little bit. I think the way that I started into modeling was basically from the cochlear mechanics point of view, but immediately wanted to make the connection between something that we could record physiologically in humans and see how it connects to the model equations. So I started building that connection, and this is also the reason why our model front end is transmission line based. It includes the generators of otoacoustic emissions, whereas other approaches use sort of more filter bank, but also nonlinear coupling mechanisms in that. But then, as time progressed and my research interests progressed, we started getting interested in new pathologies, the cochlear synaptopathy, which is obviously related to synapses and the auditory nerve. So that's when we started getting introduced to the models that Laurel has developed, and Ian and Mattis, etc. And it's where we started to connect that sort of model to transmission line models, and then realized that it's not so easy to take one model block and replace it by another and still have the outcome work. So I think in that phase, I think it was really interesting, and that brings me back to Laurel's second point. I think models must be as public as possible. We didn't develop our auditory nerve model from the beginning as our own. We just said, okay, there are good approaches there by Mattis, by Laurel, and others. And we'll just start from that. And if you really look down to the equations, all these models are not that different from each other. They are different in the way that they connect across frequency. They are somewhat different in their nonlinearities. But in essence, modeling is just modeling a physiological behavior, and somehow many of the models will actually converge. So I think there are different flavors, but I think all of these models together bring us to what is the theory of hearing, I would say. And so the focus in my group has been really on, okay, one, human hearing, and secondly, connect always the model stages to the physiology of hearing in humans. So that means autoacoustic emissions, and then afterwards ABRs or ASSRs. And then we can look how hearing impairment affect the responses, try to figure out new diagnostic stimuli, try to figure out algorithms for treatment. So this is where I see the models also as a tool for new innovations, I guess, in the field. So if you see where they came from in the very beginning, because I'm not 32 years yet in research, I mean, what Laurel said as a motivation is like, oh, we needed to understand this broadband behavior, how this all works. From that to where we are today, I think all that research, all that development has brought us to a point where we can really have applications, and where we really have different labs in the world together coming up with new applications of these models. So yeah, I think this is the very interesting area. And thirdly, yes, indeed, don't fall in love with the models. I think we're all labs who are modeling are constantly refining the equations, are constantly even making hypotheses for new experiments that they're doing to see if that one parameter is a good parameter in the model or not. And I think together, sort of worldwide, we will get to how human periphery works. But yeah, all models have limitations, and I think it's important as you go on with your own work that you also list these limitations when you discuss your discussion section in the paper, that you mention these, because you know them, but make sure everybody knows them. And there's definitely no harm in mentioning the limitations. We all know that the perfect model doesn't exist. So yeah, I guess that these were my additions to the discussion.
Thank you so much. So I think I will start with one question, but everyone else in the audience, you can either put your question in the chat or unmute yourself and ask questions. So I think we both mentioned the accessibility and the model being open to everyone, but can you explain a little bit about how, like, someone who's starting to look into the models for their research, how can they access the models, and where they should start to look into, start working with your models?
Yeah, I think, most of the papers include a link, that'll go to some resource. Either, in our case, we usually post things. We used to post them on a lab website, but now we post everything on OSF, which will host code and manuals and documents and things like that. But many of the models are also available through AM Toolbox, Auditory Modeling Toolbox. They have pretty high standards in that they want you to post the code that made all the figures in your publications. So we've started doing that on our OSF site too. We don't just put the code, we used to just put MATLAB code up there and good luck figuring out how to use it. Now we try to make it a little easier by, you know, also providing all of the code that we use to make our figures and the basic data that was included in those figures if necessary, if there's data provided. So, but I think it's more than that too, because the code itself needs to be accessible, readable. One way to make sure that's true, of course, is to get someone to read it or to try to read it and use it. I don't know, Sarah, you probably have other thoughts about that.
Well, I mean, yeah, similar like you, I think most of the publications in our case, they also have always a model version that goes with that publication. Because we know the models develop, so we only release the next formal new GitHub package at the minute that there's also a paper that goes with it, especially that you can then also replicate those figures exactly in that publication. I think they are good starting points. And yeah, I think with the way that we now use more MATLAB and Python, that in itself it is more accessible. I think when I started programming, this was all in Fortran. These transmission line models, that was definitely not accessible. It took me 3 months to read through and understand how these transmission line models were solved. But I think this is, I mean, it's more condensed, it's easier now. But you need a little bit of programming background. I think if you're going to start modifying model parameters, I mean, you can do two things. One is just say, I take my stimuli, I use the model as a black box, and then you just need to run it. I think most code is accessible to do that. Laurel has very good interfaces and graphical interfaces. For us, there's always sort of simulation code for a very easy, quick stimulation to do, so you can play easily a stimulus and plot what the result is. This is always offered. But if you're going to do model development, then I don't think you can do anything other than to dig down the code. And yeah, if you need support along the way, I think it's also very common practice in our field to just email the authors of the papers and ask ask for help if you don't get it, because it's not super easy, but yeah.
Thank you. I have a question. Laura, do you want to add anything or?
I was just going to try to put a link up.
Okay.
Having trouble, but I'll get there.
Okay. So maybe I can ask one of the questions in the chat from Sunil Puria. The question is, OCT is now a mature technology for directly measuring nonlinear vibration of the intact cochlea. What cochlear mechanic measurements might be useful for improving the AN nonlinear models? Maybe we don't need any more vibration measurement and need AN measurements.
That's interesting. Let's see, let me get back to this. A lot of this depends on how you just define the initial goal, right? So in our case, we want to know, we want a good description of the auditory nerve responses that we will then use as the input to the brain, so to speak. And so in that case, what we really need, as you say, is auditory nerve responses. We include a cochlear model and hair cell models and so forth to try to get the nonlinear aspects of the auditory nerve responses right. But at the end of the day, what we validate against is the auditory nerve responses. However, if your goal is different and you really want to know, what's going on with inner hair cell transduction, then you need inner hair cell inner hair cell voltage measurements and so forth. I do follow the cochlear mechanics work. For example, in the apex, we all want to understand what's going on in the apex because that's where a lot of important aspects of speech sounds are coded. have to say right now it's very confusing what's going on in the apex. If you go to the sessions, for example, at ARO, there's still a lot of, I don't know how to describe it, uncertainty um, from the OCT measurements, which seem to be turning up new things, different things, conflicting things. Um, so I think it's going to be great as that settles out and there's some more consensus to try to include that and see if we can get the mechanisms more correct. But at the end of the day, what we needed to do is describe for our purposes, we want to describe the auditory nerve responses. But I think the real question is, it depends on your goal. I'll let Sarah.
Yeah, I think we're very interested in the cochlear mechanics still, because we want to try to find this sort of sweet spot between simulating basilar membrane vibrations in a 1D cochlear model, because that's what it is, and then at the same time getting the auditory nerve responses correct. And one of the issues there is that if you look at human filter tuning, and in a 1D model, the gain and the tuning are linked by a 1D model. That means that if you want to fit the human tuning, you will only end up having, let's say, 40 dB of gain. Now, in the basilar membrane, 14 dB of dynamic range and gain is not an issue. But of course, the problem starts getting there that when you come to the drive to the inner hair cells, you may have actually created more gain due to the 3D cochlear mechanics. And we don't capture that in the model right now, and you can't get it right. So you can get the otoacoustic emissions right by setting the basilar membrane gain and tuning, but you cannot at the same time fully capture all the features that you would see in AN tuning. So I think at some point, we definitely need to figure out elegant ways to improve the 1D cochlear models to get the drive to the inner hair cells more correct. So there are a few labs, I think the Alto, Renata Sisto, Chris Shira, they have come up with equations that would go from the 1D and incorporate some 3D mechanics through cochlear pressure focusing. And I think we need more development there. I think it would be really nice to have some sort of an additional, let's say, filtering stage, but I wouldn't call it a filter, that actually maps the basilar membrane responses better to the drive to the inner hair cells. And it's so difficult to access this. The OCT measurements are for us opening up this field, but we're not there to have this unified theory. John Guinan, for example, there's a lot of theory, but we still need these OCT measurements to be able to come up with elegant equations that couple the two. Yeah, and
acoustics data, because a lot of the measurements in OCT are on animals. So we're talking about auditory nerve, but psychoacoustics, there's a rich literature there.
Yeah, but I mean, that doesn't get you to what drives the inner hair cells. Is it basilar membrane? Is it some fluid mechanics that we don't know? We just don't get there. That, I think for me, this is the single most missing part, and it's so crucial in all our hearing. There's a lot of theories, but not a unified one. And even if you go through the 3D mechanistic models of cochlear processing that include the tectorial and the reticular lamina as well, they are not expandable usually to the whole cochlea. You have also finite element models, but this gets computationally very, very difficult. And from an engineering perspective, it's not easy to use those models as part of a whole hearing model.
The psychophysical models you have to work with carefully too, right? Those are a model for the brain. The brain is involved as well as the ear. So psychophysical tuning curves are very different from cochlear tuning curves in fundamental ways. So that's one of the ways we try to bridge things together, is to take a population of auditory nerve responses along with central nervous system models and try to predict the psychophysics. But it takes a lot more than a cochlear model to describe psychophysics. even a psychophysical tuning curve, because there is that brain involved, which is a big deal.
Yeah.
Thank you. Thanks for the question and thank you for the great answers. I'm going to ask another question in the chat from Max GM. What are your approach to combining transduction encoding in your model with the variable of time? We are thinking about predicting trajectories and final outcome of performance of a cochlear implant.
So we have a pretty simple way to go from the transduction to the time, in that we just use an instantaneous input-output nonlinearity for the hair cell transduction. And it's a simplification. It was designed, the shape of it was carefully designed to achieve the desired AC to DC ratio, which controls both phase locking and average rate of the auditory nerve fibers. And we wanted to get that right across sound level and across frequency. So we designed in a transduction stage for our inner hair cell model to give us the right properties, or the properties we cared about in the auditory nerve responses, that is discharge rate and timing, phase locking. So that you could say we cheated, right? We completely designed it based on the output goal, the auditory nerve responses. We're interested, we've been discussing with Jong-Hoon Nam, trying to make it a more biophysically realistic transduction, which would be interesting for understanding things like injury. So for your question, though, I'm not quite sure how to connect this to the cochlear implant applications, in which that case that transduction's not there. So maybe I need you to clarify the question a bit more.
Max, do you want to clarify your question? Meanwhile, thank you. Yeah.
Yeah, can you hear me?
Yeah.
Yes. So we wanted to monitor how, usually when it comes to our cochlear implant patients, we often do audiograms over several different visits to make sure that we are tuning the cochlear implant correctly to how they are interpreting sound around them. It's different for each patient, which is why we are curious to see what your approaches are if the transductions like perhaps have the possibility of varying between patients or varying in terms of response, or like as in the patient's quality of response if they like what they hear over time.
So you're thinking really over time, over days, weeks.
Yeah, that's funny. That's what I meant.
Yeah. Okay. So yeah, so we have not addressed that type of situation. And this is another interesting philosophy, actually getting it. So we've generally tried to make our models quite generic. We don't tune them for even a single auditory nerve fiber. We've taken distributions of responses. I know Roger Miller was here. We've taken some of his data from years ago, and we have descriptions of tuning for the whole population. And we try to sort of draw a line through the middle of the population, and we match what our model is doing to that. In terms of, we don't tweak the parameters for differently from one fiber or another, or different CFs or whatever. We've tried to just make it quite generic and relatively, in that sense, smooth across the population. So adjusting the model for individuals is another interesting challenge. And in some of the modeling literature, you'll see that they've used different parameters for each figure because they're really trying to adjust the model for each fiber that they're modeling. But in this case, yeah, I wouldn't know how to apply the kind of models that we're using for a cochlear implant type applications, or how to adjust them to different patients, or to one patient whose performance varies over time. Have you guys done anything on those lines, Sarah?
No, not much. But I mean, for me, the question with CI modeling is always where does the electrode innervate the nervous system, and it remains a problem because you bypass so many stages, and then it's also extracellular stimulation. So this is very different from how it is in normal hearing models. So I don't know. There's a few labs who actually have written interface models between the electrodes and the ascending pathways. Know from Hanover. I also know from Torsten Douw's lab some approaches. So I mean, there's definitely work to look up there, but I don't think they account for improvements over time and patient outcomes either. I think it's too early for that.
Ian Bruce's lab, I know, and
Yeah.
Valdo Noguera in
Hanover,
in Hanover is working on cochlear implant models that are quite nice.
Thank you. Thanks. Tong also put the link for a lot of the website for both models and web app, I think, website, which is nice. So it's good to look at them in the chat. Meredith asked, how do you think we could implement machine learning or deep learning to capture these nuances between individual or different conditions?
I'll throw that to Sarah.
Well, we've developed, I mean, you need to see machine learning in two different ways. So on the one way, we've often used it as a computationally efficient way to compute the auditory models. And in this case, when you train a model for one individual, you have sort of the main architecture and the hyperparameters of this. When you then want to fit it to another individual, you would need to retrain a few of the parameters of that model to fit again the biophysical model of that person. So what I think is important there is that there are several approaches. You can go from stimulus to perception. Many machine learning approaches go this way, but we have deliberately worked modularly in our machine learning blocks so that we basically just have a cochlear processing stage, an auditory nerve stage, inner hair cell stage, etc. And this is specifically to be able to afterwards be able to simulate hearing impairments at specific stages, and to make sure that at each sort of intermediate place you would still have a connection to what a biophysical model would do. So I think if using machine learning for fast computation and then backpropagation for individual hearing damage, then I think you need to use a modeler approach and then a retraining based on physiology data of the person. But I think we can use machine learning also in a very different way by trying to figure out steps in models and in processing that we don't understand. So if you have a lot of data, you can always come up with a machine learning model that captures this process. And from that, we can maybe learn how the physiology works. So this is a completely different approach to using machine learning. So, yep, these were my thoughts. Laurel, do you want to add to that?
Well, there were some really nice sessions on machine learning, deep neural net type approaches at ARO, where I learned a lot. I think another interesting challenge that comes up with those techniques is figuring out the right cost function. The right way to train the models is tricky. And there are some interesting ideas for how to do that. I was looking, Peter Leo was on earlier, but I think he dropped off. But he has some recent papers where he's tried to design new cost functions that spread the influence of different errors at different sound levels and CFs, and try to make them contribute more equitably, so to speak, to the overall cost, which is, I think, a clever idea. But there's still some, I think, a lot of opportunities for good design as we try to develop more efficient tools for simulating these different models, which is, I think, a nice time in the work. But we're not working on that avenue much ourselves. We're still focusing on the models themselves.
Thank you. I'll ask one of the other questions from the chat from Melly. When you are modeling the auditory nerve fiber or brainstem circuitry, whether it's machine learning models, filter bank model, or Hodgkin-Huxley type model, what are the main parameters you are aiming to tune the model for? Is it the spontaneous rate, driven rate, PSCH shape, synchronization, etc.? Trying to fine-tune a model parameters to hit all of these goals is hard, while tuning the model to catch one of these aspects, usually some other aspects are lost. What are your opinion on that?
That's a good question. I think again, it depends on your goal. So if you're worrying about speech, then you want to get driven responses, not spont, right? You need to get driven responses right, but you might want to. It depends on which fibers you're following into the nervous system and where you're going as to whether you need to get all the different spontaneous rate groups correct, for example. We have strong feelings about that. I think that, I'm very interested in the high spontaneous rate fibers because they're the majority and they drive the cochlear nucleus, which drives the ascending pathway. So I tend to focus on the high spots, but we've gotten interested in the low spontaneous rate fibers because they influence the efferent system, we believe. So we don't lose track of those fibers either. But in general, if you're providing inputs to higher stages of the nervous system, then what you care about is what those cells care about, right? So when we're following signals up to the midbrain where neurons are interested in modulations, their IC inferior colliculus neurons are tuned for the modulation frequency of the input. So in that case, we need to get the responses to modulations correct, right? So it depends on what your goals are. I used to worry back when I was young. I was worrying a lot about cochlear nucleus responses. Cochlear nucleus cells care a lot about temporal fine structure. So in that situation, I had to get the temporal fine structure right. The phase locking and its nonlinearities and so forth were very interesting to me. But with age, I realized that you lose temporal fine structure as you ascend the auditory pathway. So at the level of the IC, there's very little temporal fine structure left. So we worry more about the lower frequency fluctuations. So the answer to your question, I guess, is it depends. It depends on what you're going to use the output of your model to, what the goal is for the output of the model and what the next stage really cares about or is sensitive to.
Thank you. Sarah, do you want to add?
And well, I think Laura was very complete here, but I think I want to link it to one of the other questions that's in the chat as well, because as Laurel said, you start losing maybe fine structure and it's encoded differently. But then, for example, from this machine learning approach, you could say, like in the question, you can take speech and then go all the way to the speech coding or speech perception. Do you then need all these intermediate steps? I think to train a neural network model of this whole sequence, you do not. But the problem is how generalizable will it be? Because your model will be simpler. You actually skipped stages in the processing pathway that are actually there. And we're going to get a translation from a feature that's there in the cochlea and that looks different in the auditory nerve, that looks even different in the CN. But if you then look at how hearing impairment works, it's gonna modulate or modulate is alter, let's say, that representation in a way that's biophysically plausible. And I don't think you can take one model, go from speech and to a neural representation. You can, but it won't be generalizable to hearing impairment, I think, or to processes that are actually linked to the physiology, or you can't use that method maybe to predict how envelope coding works in the auditory system. I don't know. So I think these different approaches have different applications. But I think if you want to stay generalizable, or if your solution should be generalizable to hearing impairment as well, then I think you're into trouble if you train a full system from speech to representation.
Yeah.
Thank you.
So yeah, responding to Sunil's earlier question,
Yeah.
I don't think you need, I mean, you don't need to include OAEs,
No, maybe
otoacoustic
not,
emissions,
but
and
you cannot
ABR.
skip all stages in between.
No,
either.
but I don't think it's necessary. But if you've got data that includes OAEs and ABRs, then it makes sense to take advantage of that.
Yeah, definitely.
Yeah, but we model speech intelligibility without those signals, and well, we're focusing on something different. We're focusing on how noise affects speech intelligibility and trying to model it for individual listeners. So, and we don't have those data for the individual listeners, but we'd like to, so if we do, then that'll change the game a little bit.
Yeah. Yeah, I think we use those OEs, ABR mostly to individualize the hearing loss parameters of the models. You don't necessarily need them to train the whole system, I would say. But yeah, I mean, yes, you can definitely do without from a first approach. Yeah.
Yeah.
I think that was a very interesting question. Maybe I can add something to it as a question. I work with a model at my PhD, and now I'm doing experiment. I'm using the model to design the experiments, and I'm thinking about the output of these models, if there are OEs and ABRs or FFR or different types of response that could help experimentals also to optimize their experiment design using the model. If you have any comments on that, I can.
I think it's a great approach because you already have a hypothesis before you start measuring. And we all know that when we get to human measurements, maybe you can measure 6 EEG conditions and not 25. So then you let your model already choose the most promising experimental stimulation paradigms. And I think this is how these two things work in synergy. Yeah? If then your recordings don't confirm your model predictions, then we know something's wrong with the model, and then you can update the model again. So this is a good synergy.
Yeah. And I think you also have to remember that there's a stage that goes from the inner workings of the model to the OAE, or from the inner workings of the model to the ABR, and that's another model, right? So you have to keep an eye on that too, and try to convince yourself that that's doing the right job, and maybe that it's appropriate for both human and chinchilla, or whatever your experimental animal is. So that's a little bit of something that you need to test.
Yeah. So I ask another question from the chat. Morgan asked, in what stimuli would neural fluctuation predict a different response than TFS coding, for example, in phonon or vowel discriminations?
Yeah, so this is referring to the code that we worry about in our lab a lot, the so-called neural fluctuation code, which focuses on low frequency fluctuations. So this code is very different from TFS for something like speech or even AM. So phonemes and vowels would be included in that. So for most complex sounds that have interesting envelopes, even noise, the responses up at the level of the midbrain are strongly driven by these relatively slow fluctuations in response. So we realized back in 2007 or so, 2008, that our model, the old auditory nerve model that we used, really did a poor job on amplitude modulated stimuli. And we were getting interested in amplitude modulated stimuli. So that was a critical stage for us. We had to step back and try to figure out A, why it was getting it so wrong, and B, how to fix it. And that was critical for us, moving forward in time to be able to start really thinking about this code. And partly it was our mindset because before that we had really focused quite a lot on TFS coding. We got that right, but and we hadn't really worried about AM until someone came along and used our model for AM and said, hey, this really doesn't work very well. And we also learned at the time that none of the other models in the literature at that time worked for AM, for, stimuli with modulated amplitudes. I don't know if I answered your question, Morgan. But we can give
Yes,
Sarah the
indeed.
next one. Okay,
Yeah,
great.
indeed. This was very interesting. Thank you.
Yeah.
It's just that this idea is very new to me of neural fluctuation coding, and I'm still trying to understand how it impacts like the simulations we do and the outcome of that and how they would be. So it's a pretty new way for me to look at the responses.
Mhm.
Thank you. So next question is from John. How do these encoding models differ from traditional LN-based models that use spectrotemporal receptor fields?
You want to try that one, Sarah?
Yeah, I'm thinking.
Yeah.
Um,
I think one way to think about it is I think it's true for both of our approaches. The nonlinearity starts, it's really embedded in the filtering stage, right? The properties of the peripheral filters are changing with sound level, which is quite different than, sort of starting with a linear receptive field and following it with a nonlinearity. But there's probably some things you could get very close with that approach, though. Any thoughts, Sarah?
yeah, I was just thinking if we build forward to the models, then we'll be able to actually compare them, I think, at some point. But we're not there yet. I think they were
Yeah.
basically developed for other purpose back at the time. But they're definitely different. I mean that's
Yeah.
clear. Because I mean you mentioned some of the input features as you said.
Yeah, I can think of another kind of a qualitative difference that might be important. In the spectrotemporal receptive field, you might see, I don't know if everyone's familiar with these, if you just put noise into the ear and measure spike times and then do it's sort of like a reverse correlation type analysis to get the spectrotemporal receptive field. You'll see areas that look like they're excitatory and areas that appear to be inhibitory, right? And then you can follow that with a sort of a instantaneous nonlinearity to try to capture things like compression. But I think a lot of what you're seeing that looks sort of suppressive or inhibitory in the spectrotemporal receptive fields is not, we know it's now that it's not inhibition at the level of the auditory nerve. It's actually probably suppression in the cochlear mechanics. So I think it's a little bit tricky to handle that with a linear description. The SGRF is a linear description, and then just follow it with a nonlinearity, when in fact, many aspects of the SGRF itself are really reflecting nonlinearities in the periphery. So it's a sort of thing that it might work depending on what your purpose is. I think it'll be hard to get the auditory nerve responses to really match real auditory nerve responses. but I could be wrong. Yeah.
Um, Thanks. I can ask another question. So maybe a more general. So I wanted to ask, where do you think the modeling world is going, or what is a specific interest of you for working next on these models? And along that way, is there any lack of data that you're thinking about, like experimentalists should think about collecting those data specifically, or any other aspects of the research that limit you to go through that way that you're thinking about the future of these models?
I'm going to let Sarah start on that one.
Yeah.
I have a long
But
answer,
I
but
mean, if I think of just like the European research agenda overall, in silico approaches, digital twin approaches for new health innovation is definitely a thing. So from the application perspective, all these many years that we've done modeling is really bringing us to a whole new era of being able to test hypotheses, test treatments, and do things like that. And so I think they're a very nice tool in the next generation of technologies that are to come. But from the other aspect, the more basic science aspect, I think what I like and I would like to still see over the coming years is fields coming together. So I like to go to the cochlear mechanics meeting because there I learn, I still don't have the transduction figured out, but that community has the data to do it. And at ARO, I come to speak to all the auditory nerve and the single unit people to figure out, okay, what is missing there. I think modelers together in the field need to build the theory of hearing. In the end, there's one explanation of how hearing works, and I think we need to keep putting effort to get the people of different fields together and together figure out the missing gaps. And in the meantime, we already see for some things that we understand very well that very many different models use exactly the same equation for the three-store diffusion model.
yeah.
So this is something that we can agree on, that that's the good thing to put there. For the other things, we're not so clear yet. But I think, yeah, for me, this is the fun part about the basic modeling, is to just be able, okay, how much data can we from different fields explain with the theories that we have today? So I
Yeah.
think these were my thoughts.
Yeah, so quick answer, the three-store diffusion model won't work for complex sounds. So we can agree not to use that one. But
Also fine.
but I think another interesting and very different from what Sarah described, another interesting direction, which is to include the other half of the auditory system, which is the efferent system. And I think we're just starting, and Afaga's worked on this in her thesis work, to model or to include the descending pathways from the brain back to the ear. And I think to my mind, that's very important to describe in order to understand the whole system and how what might be going wrong with hearing loss. As it is, we really don't understand exactly what goes wrong with hearing loss, but we're ignoring half the system. In terms of what data we need for that, that's tricky because we do know that the efferent system is largely suppressed under anesthesia. So a lot of the classical literature has either very suppressed or missing efferent effects. We have to get either more physiology in humans or in awake animals in order to try to flesh out this story. But that's, I think, a direction that we can work on quite a bit with modeling. And as Fag was saying, design the experiments, perhaps that we can use then to try to understand the whole system.
Mhm.
So it's a very different direction from the sort of pushing ahead, which also makes sense with the in silico type simulations. I think an interesting thing about modeling is you can find your niche. You can find the questions that interest you and sort of follow that path. There's a warning we should make to people, especially if they're young people. Modeling is a terminal disease. So you should be careful as you tip your toes into it. There's no going back. Uh, you get sucked in for the rest of your career. Um, so I guess that could be a good thing. But don't think you're going to get to the end.
I can vouch for that.
Yeah.
Thank you so much for great answers to my question. I don't see any other question in the chat, but maybe we can finish this session. But by the final question, that what is your advice about modeling and for new trainees, maybe that they are just starting their work and they are interested in using the model for their experiments, but also thinking about improving the models, where they should start, or any advice, or you already gave us a lot of great advice, but any final thoughts about this session?
Well, I might add that the modeling is also a community and we know each other well. And so don't sit there alone in your corner trying to fix your model. Reach out to people, reach out to communities. If there's a new model, there's a new model and we'll embrace it. And like that's the thing. New approaches are valuable to all. So just connect. And if the professors don't answer the emails, their students will. So, I mean, there will be someone, and meetings, don't hesitate. Everybody's here to help. So I think that's important because it can be lonely if you're trying to figure out model code just from scratch. It might take you months. You might be stuck. Don't be stuck. Reach out.
Definitely. Yeah. Our very first paper, we left out the value of one parameter by mistake. And months after, I had given the code on an old floppy disk to a colleague. That was my first code sharing. And months later, he called me and asked me for the value of this parameter. And I said, what? And, I said, it was on that disk I gave you. So we couldn't find a computer that would read that old disk. He was at Carnegie Mellon. Their computers were way ahead of ours. And so he had gotten a grad student to program it up from scratch from the paper instead of calling back and asking for a 3¼ inch floppy disk. But definitely reach out and ask. Question. It's hard to get funding for modelers. I was encouraged by Roger Miller to write an R01 with the word model in the title, but it was a bold and daring move, and we actually did get it funded. But you're right. Over the years, I've always tried to mesh experimental and modeling work in my grant proposals.
You have to.
Because it is very true that the reviewers don't like pure modeling studies. They really want it to be meshed with experiments. But that's where collaborations can help a lot. Because if you find that you are a pure modeler, you can always collaborate with experimentalists to try to make the team that is fundable. Yeah.
I think the same holds for Europe. So people see a lot of merit in modeling work, but when it connects to data, I've never gotten a pure model proposal go through. Yeah.
Yeah. Yeah, that's a really good point. I think there's a lot of value, though, in pursuing both experimental work and models.
But that's the fun. That's the fun.
Yeah.
Thank you so much. It was a good discussion, and I think we are done with our time. I want to say thank you again for everyone who joined us, also for the speakers, Laurel and Sarah. Thank you so much for all your great advice, and keep an eye for the future session from this initiative. There is going to be a lot more happening, and we are very excited for them. Thanks again, and have a good day, everyone.
Thanks, Afag. Thanks, Tom.
Yes.
Yeah, everyone.
Thank you.
Bye.